Welcome to the Monteith Abstract Open Enrollment for the 2021-2022 plan year. In this presentation, we'll walk through your benefit options. Please review this information carefully along with your employee benefits guide and summary benefits and coverage. Monteith Abstract is pleased to announce that Scott & White will continue to be the medical carrier for their employees and their dependents. In the next few slides, we'll be reviewing the plan changes for the base, mid, and the buy-up plan. The base plan, the deductible for out-of-pocket, has increased to $12,900 for an individual and $25,800 for a family. The mid plan, the primary care copay for pediatrics 0 to 18, will be covered at 100%. Specialist copay will increase to $60. The urgent care copay will be at $50. Emergency room copay is now $500, then 20% coinsurance. The physical, occupational, speech therapy has changed to a $30 copay. Diagnostic labs are now covered at 100%. The deductible for an out-of-pocket has decreased to $5,000 for an individual and $10,000 for a family. On the buy-up plan, the out-of-pocket has increased for in-network to $4,000 for an individual and $8,000 for family. The primary care copay for pediatrics 0 to 18 is now covered at 100%. Urgent care copay went down to $50. Emergency room copay is now $500, then 20% coinsurance. Physical occupational therapy has changed to $30. Diagnostic labs are now covered at 100%. The deductible for out-of-pocket has decreased to $3,000 for an individual and $6,000 for a family. The out-of-pocket for out-of-network increased to $12,000 for an individual and $24,000 for a family. The dental has no changes with Guardian. The basic life will remain the same at a $5,000 benefit with accidental death and dismemberment. The vision will remain with Guardian and there's no changes. The voluntary life has received a small increase. Please review your benefits. If you have questions about your benefits, please contact our insurance agency, Gallagher Benefit Services. Gallagher's contact information is listed in your benefits guide. Gallagher has an entire staff of people dedicated to helping you with benefits-related issues that come up for you and your family throughout the year, including claims questions. Please feel free to contact Gallagher at any time if you need any help with explanation of benefits, finding providers, ordering ID cards, appeal letter writing, benefit questions, eligibility questions, claims resolution, and COBRA questions. Our benefit plans are renewing on June 1st. The open enrollment period will begin on May 10th, 2021 to May 14th, 2021. Monteith Abstract is proud to provide our employees and their families with a comprehensive, affordable benefits package, including medical, dental, vision insurance, life, voluntary critical illness, voluntary accident, and a health savings account for those that are on a high-deductible health plan. The elections you make will be valid for the remainder of the company's plan year, which will end on May 31st, 2022, unless you have a qualifying event. Examples of a qualifying event are marriage, birth of a child, or spouse's job change. If you have a qualifying event and would like to change your coverage during the plan year, you must make the change within 31 days of the event. The only exception to the 30-day rule is if you become eligible for premium assistance under Medicaid or the Children's Health Insurance Program. In that case, you will have 60 days to make the changes to the plan. Before we begin, it's important to point out that Monteith Abstract's medical plans meet the minimum value and affordability requirements of the Affordable Care Act. If you elect to waive this medical plan in favor of a plan at the healthcare.gov marketplace, you will not be eligible for a subsidy or premium assistance. Monteith Abstract will be offering 3 benefit options for you and your family. You can elect from the high deductible health plan, the mid plan, or the buy-up plan, whichever best plan works for you and your family. For illustration purposes, we'll be reviewing the in-network benefits for all 3 plans. The lifetime benefit maximum is unlimited. The calendar year deductible begins January 1 through December 31st. Let's begin with a high deductible health plan. The deductible for the high deductible health plan is $6,450 for an individual and $12,900 for a family. The out-of-pocket maximum is $6,450 for an individual and $12,900 for a family. This includes your deductible and copays. Your coinsurance is covered at 100% after your deductible. Your doctor's visits for primary care and specialists is subject to 100% after your deductible. Your wellness care is covered at 100% and it includes immunizations and well baby care and mammograms. For the prescription drugs for generic, name brand, and specialty drugs are subject to 100% after your calendar year deductible. Let's move on to the mid plan. Your deductible for the mid plan for an individual is $2,500. For the family is $5,000. The out-of-pocket maximum includes your deductible and copays. Your out-of-pocket maximum is $5,000 for an individual and $10,000 for a family. The coinsurance is 80% after your deductible. Your primary care visit is $30. Pediatrics are covered at 100% for age 0 through 18. The specialist office visit is $60. The wellness care is covered at 100%. This includes immunizations, well baby care, and mammograms. For the prescription drugs under the mid plan, for generic is a $10 copay, preferred brand name is $45, and non-preferred generic and brand names copays is $85. Specialty drugs for Tier 1 and Tier 2 is 15% of the charges, and Tier 3 is 25% of the charges. You do have mail order for a 90-day supply at 2.5 times your copay. The buy-up plan. The buy-up plan has a calendar year deductible of $1,500, $3,000 for family. The out-of-pocket maximum is $4,000 for a single and $8,000 for a family. This includes your deductible and copays. Your coinsurance is 80% after your deductible. For the primary care visit is a $25 copay. Pediatrics are now covered at 100% age 0 through 18. Specialist visit is a $50 copay. Wellness care is covered at 100% for immunizations, well baby care, and mammograms. The preferred drugs is an $8 copay. The preferred brand name is $35. Non-preferred generic and brand is $70 copay. For specialty drugs is a $200 copay for Tier 1, Tier 2 is $300, and Tier 4 is $400. The mail order is 2.5 times your copay. Emergency services are subject to your deductible on the high deductible health plan. For those that are in the mid and the buy-up plan, you'll have to pay $500 copay, then 20% coinsurance. If you use the ER and are admitted to the hospital as a result of that emergency, only your facility copay will be waived. You will still be responsible for your deductible and coinsurance, since it would then be considered a hospitalization. You can save time and money by visiting an urgent care. The urgent care copay is $50. For hospital and surgical services, all charges will be subject to your overall calendar year deductible. Then the coinsurance will apply until you reach your calendar year out-of-pocket maximum, noted on the previous slide. A visit to the emergency room can be a very costly expense. For minor emergencies, you can save time and money by visiting a contracted urgent care facility. However, be aware that certain freestanding buildings may look like an urgent care facility, but are actually associated with a hospital. This means that they'll also bill you as a hospital. Better cost savings will come from visiting your doctor's office or a convenience care clinic. However, the least expensive avenue is a virtual visit. When you're sick or need care immediately, a virtual visit is a convenient way for you to start feeling better faster. With Scott & White virtual visits, you can see and talk to a doctor via mobile device or computer 24/7, no appointment needed. The doctor can give you a diagnosis and prescribe you a prescription if needed. Virtual visits can be considered after hours or during holidays, or when your primary care doctor is unavailable for non-emergency needs. Many urgent care alignments can be treated with virtual visits, such as colds, sore throats, flu-like symptoms, upper respiratory infections, allergies, sinus infection, ear and eye problems, or skin conditions. Virtual visits are not for emergency situations such as chest pain, abdominal pain, or shortness of breath. By registering for Scott & White, you'll receive access to many features, including viewing your explanation of benefits for recent claims, prescription pricing for generic substitutes, information about free preventative care, urgent care and convenience clinic facilities in your area. The dental plan will continue to be administered by Guardian. The dental plan includes an annual benefit maximum of $1,500 per covered person and an annual deductible of $50 per individual and $150 for family. The deductible applies to services in basic and major categories. The deductible does not apply to preventive care or orthodontic services. All covered preventative services include 2 cleanings and exams are covered at no cost to you. For basic services such as fillings, root canals, or oral surgery, the plan will pay 80% up to an annual maximum. For major services including crowns, dentures, and bridges, the plan pays 50% up to the annual maximum benefit. The plan pays 50% for orthodontic services, up to $1,000 per lifetime for children under the age of 19. Your dental deductibles and coinsurances are the same regardless of whether you visit in-network or an out-of-network provider. Using an in-network provider, however, will result in a lower financial responsibility for your family overall. You'll save the most by visiting a Guardian in-network dentist. An average is about 25 to 40% discount. This dental plan does let you visit a licensed dentist, but you'll maximize your plan value by visiting and taking advantage of the Guardian network. The Vision Plan will continue to be administered by Guardian. The Vision Plan uses the VSP network. If you visit an in-network provider, you'll pay a $10 copay for exams and $15 for materials. For glasses, the plan pays up to $130 for frames, and the standard lenses such as the single vision, bifocal, trifocal are covered after your $15 copay. Lenses, add-ons such as tint, UV, scratch-resistant coatings are available for additional cost. Progressive lenses are also available for additional cost. For elective contact lenses, you'll receive a $130 allowance. The plan covers one exam every 12 months, and contact lenses are also covered every 12 months. You can choose either contact lenses or glasses under the plan. If you prefer the glasses, the plan covers new lenses every 12 months and new frames every 12 months per calendar year. If you visit an out-of-network vision provider, you'll have to pay the cost of the covered services up front. Then you'll need to submit your claim for reimbursement at a reduced benefit level. The basic life and AD&D will continue to be administered by Guardian. As a full-time employee, you'll have employer-paid life and AD&D at no cost to you. Employees receive a life and accidental death and dismemberment benefit of $50,000. No medical questions are required. This benefit does reduce at age 70. Guardian will also administer the voluntary life and AD&D. In addition to your employer-paid life insurance, you may purchase additional life and AD&D coverage for yourself and your dependents. You may purchase additional life insurance and AD&D coverage for yourself in $10,000 increments up to $100,000. At your initial new hire offering, you're guaranteed a $100,000 benefit for yourself without having to answer any medical questions. If you previously waived this coverage when you first were eligible, you'll have to complete a health questionnaire for any amount of that coverage. You may have purchased up to $50,000 of coverage for your spouse in $5,000 increments. At your initial offering, your spouse is guaranteed $50,000 of coverage without having to answer any medical questions. If you previously waived coverage for your spouse when you were first eligible, your spouse will have to complete a medical questionnaire for any amount of coverage. For your children, one dependent premium includes $10,000 life and AD&D benefit for each of your dependent children. Voluntary accident and critical illness will be offered through Allstate. As an employee of Monteith Abstract, you have the option to enroll in the voluntary accident. The voluntary accident is off-the-job accident coverage. You have the option to pick option 1, 2, 3, or 4. Accident insurance covers you in the event of an accident. It'll pay if you have an urgent care visit of $100 for option 1. Option 2 would be $150, and option 3 and 4 will be $200. If you were in an ambulance, option 1 will pay you $600. Option 2 will pay you $900, and option 3 and 4 will pay you $1,200. You get to choose which plan works best for you and your family. This plan will pay you and will reimburse you if you were in an accident. The voluntary accident also includes benefit enhancement riders that will pay you if you have any burns, skin grafts, brain injury diagnosis that are due to an accident. It'll even pay for eye surgery, blood and plasma, or any rehabilitation or broken tooth if this is due to an accident. This will be reimbursed through Allstate. The Allstate premiums are designed for option 1 monthly for yourself, spouse, children, and family. Same for option 2, 3, and 4. You have to choose which best option works best for you and your family. Monteith Abstract offers voluntary critical illness. You have the option to elect option 1 at $10,000 or option 2 at $20,000. This plan will pay you in the event that you have a heart attack, stroke, critical illness such as cancer, or if you have end-stage renal failure. This plan will also include a wellness rider. It will pay $50 to you in the event that you have a preventative screening with your primary care physician. Allstate provides these premiums that are based by tobacco and non-tobacco users. It also issued by your age. If I am 44 years old, I get to choose between the 40 and 49 rate. I get to elect coverage monthly, either Plan 1 or Plan 2. You could pick which best plan option is best for you and your family. Please reach out to your human resources for medical deductions costs per pay period for the medical plans for the high deductible, mid, and buy-up plan. In this chart, you'll see the monthly premiums for the dental and the vision. Please complete the application regardless if you're making any changes to your coverage. Turn in your application to Human Resources by Friday, May 14th. Please don't miss the opportunity to enroll and change your elections. Please do not hesitate to reach out to the Gallagher team if you have any questions regarding your employee benefits. Thank you for attending the open enrollment for Monteith Abstract Title and Company. The plan year will begin June 1st, 2021 through May 31st, 2022.